Good evening. I'm Dr. Fred Rouse, the Real Money Doctor, and it's currently 7 o'clock. 7 o'clock on Thursday evening, the 21st of May. And I want to touch base on today's events that help you get, protect, and enjoy your money, your life, and your retirement. Now, the thought for today is another Thursday, another 2.4 million. Well, we'll get to that in just a few minutes. Well, for now, we start every day with the current number of COVID cases, just to keep track of what's going on in the world, because that's the biggest thing that's affecting everything right now. Now, right now, as of today, we have 1,573,000 cases in the U.S. That's close to 25,000 more cases than I reported yesterday about this time. Now, the total deaths right now in the U.S. are 94,566. Okay. That's just in 11 weeks. 94,500 people have died in 11 weeks. And it's another 1,400 more than we talked about yesterday. Now, it's not all bleak. Some people are actually recovering. And right now, there's 29,000, roughly 29,800 or so, that have actually recovered, okay, from COVID, which is really impressive. And that's an increase of 41,000 people overnight. Now, for a while, that number hadn't been changing at all. It started changing earlier this week, which is sort of a positive sign. New York State still has the largest number of cases right now. They have 356,000 cases, okay, and that's another 1,500 since yesterday, which isn't obnoxious for them, but it's still an up number. The number of deaths that they had yesterday or overnight, or total actually, my apologies, were 28,700. Okay, that's 96 people that died overnight, which is the second day for New York State that they've had less than 100 people die overnight. So that's also a relatively impressive number for them. Now, New Jersey State still has the second highest number of cases right now, with 150,700 cases. And there are no new cases reported overnight. Now, I'm not certain what's going on with that. It was 150,000 yesterday. It's 150,000 today. There's actually been no change in that number. And when there's absolutely no change at all, I question if it's a data error. So we don't really know. We'll find out what's going on with that. However, right now, their deaths in New Jersey have totaled 10,843,000 people died. And that's 94 people died overnight, which is New Jersey's first day of being less than 100, which is also relatively impressive for them. Now, New York and New Jersey are the first two states with the highest number of cases. And then Illinois comes in at number 3. Okay. Massachusetts comes in at number 4. Okay. California remains at number 5. Pennsylvania is still at number 6. Okay. Michigan is still number 7. They're having their own problems with the floods right now. Texas is number 8. They've got a whole set of problems down there also. Okay. Number 9 is Florida, and number 10 remains at Maryland. Now, the deaths in both New York and New Jersey have really dropped down a lot. Okay. And this is the first day that both states, New Jersey, and New York, have been under 100. So that's relatively impressive. And that's relatively good news, unless you happen to be one of the 100. Okay. In which case, you're not real thrilled. Okay. Your family's not real thrilled. Your coworkers are not real thrilled. Because these are big numbers. But behind each one of these numbers is an individual person, an individual family, a mother, a father, a brother, a sister, a coworker. Okay. So things are happening. Okay. And we can't forget. It's too easy to forget. And people are just trying to wipe this under the rug. No big deal. Okay. More people die in flu season, regular flu season. No, they don't. Okay. This is an amazing amount of people who have died basically in the first 5 months of this year. An amazing number of people have died in the first 5 months of this year. Now, all this is happening as all the 50 states have reopened to some degree. which brings me to the thought for today. Another Thursday, another 2.4 million. Okay, 2.4 million what? 2.4 million cases of unemployment. The U.S. Department of Labor released a report earlier today that the U.S. saw an additional 2.4 million people file for unemployment claims for the week ending May 16th. That brings the total unemployment claims to 38.6 million since the start of this COVID pandemic. Now, the Labor Department's press release said the COVID-19 virus continues to impact the number of initial claims and ensure unemployment is impossible to know when businesses and consumers will be able to return back to work as normal as the country is reeling from the effects of states shutting down business in an attempt to slow the spread of COVID. Now, that's from the Labor Department. There is basically no way of predicting when this is going to stop, when these unemployment numbers are going to change, because it's a healthcare crisis, not an economic crisis. The healthcare crisis started the economic crisis. Now, the cause of this recession is a global pandemic, and that means our economic future will be determined in large part by the path of the virus. And that's according to the president of the Federal Reserve Bank in New York, John C. Williams. Unemployment numbers in the United States are likely to worsen before any improvement is seen. Now, according to data from the April unemployment rate, stands at a staggering 14.7%, a figure I hope that I'd never see in my lifetime, and one that is sure to get worse before it gets better. If I think back to the economic picture in February, no one could foresee this would have been our reality within a few short months. We all know the incredible strain that New York City has been under, with the numerous patients being diagnosed with COVID on a daily basis. But upstate New York has also been deeply affected, not just by the spread of the virus, but also by the profound economic fallout, according to Williams. Now, New York has seen over 2 million claims paid out during the pandemic, according to the state's Labor Department. Now, the CEO of the Fed said that the Fed will take extraordinary actions to ease the economic pains. The actions by the Fed include, buying up large quantities of U.S. Treasury securities to stabilize the financial markets and setting programs up to make credit available to households and businesses. Now, all that sounds really, really good. Okay, you get on and, oh, the Fed's doing this, the Fed's doing the other, and they're going to stabilize things. Well, that sounds really, really good. And it should really have some effect. However, most of that effect is going to show up in the stock market and in big business. Now, again, I work with small people, the mom and pops, the 0 to 6 employee types. Okay, I don't see any of that currently translating, to anything for my mom and pop business owners that are on Main Street. And it all comes back to consumer confidence. Okay, that is directly tied to the feelings about COVID. And are they going to get sick and possibly die? That brings us back into testing. Now, that's the other thing I want to discuss tonight. Coronavirus testing in the U.S. is disorganized and needs coordination at the national level, infectious disease experts said in a new report released Wednesday. Right now, testing is not accurate enough to use alone to make most decisions, including who should go back to work or to school. Okay, according to the team of University of Minnesota, they said it's a mess out there. Dr. Mike Osterholm, he's the head of the university's Center for Infectious Disease Research and Policy. He issued this report. Testing is very, very important, but we're not doing it. We're not doing the right testing. The number of tests that have been completed, the numbers widely reported by the states and by the White House, show only part of the picture the report reads. Now, the data is likely, kind of screwed up. According to Dr. Osterholm, he said it's because the public health system, is just overwhelmed. The report has some specific recommendations for diagnostic tests that check to see if someone is currently infected with coronavirus. Testing is most useful for clinical care patients, for disease surveillance and for contact tracing and for monitoring frontline workers, such as emergency responders, doctors and nurses who may have been exposed, and the report recommends that people with symptoms should also be tested. It says, but coronavirus testing is not accurate enough yet to use in many other ways, according to Dr. Ulsterholm's report. Now, it recommends against universal testing in hospital settings, testing in schools or other low-risk settings, widespread community-based testing, and antibody testing to decide who goes back to work. He also doesn't think that immunity passports are a good idea, and he thinks it might be useful to test asymptomatic people in long-term care facilities, in some cases because they're likely to have many cases. And asymptomatic shredding actually, of the virus may be detected with a molecular test, which looks for the virus itself, or an antigen test that looks to pieces of the virus. Now, it's not clear just where and how asymptomatic individuals should be tested. Now, a report goes on to say that should be used with caution. These tests check for blood evidence of an immune response to the virus and indicate that someone has been infected for some days or even has cleared an infection. Okay, they are most useful for identifying donors for plasma that need to be treated, used for treating patients, and for deciding how to manage patients once with standard diagnostic tests are negative. Now, the report says it's not clear if antibody testings are useful for testing of healthcare workers to determine their immune status, according to the report. Now, we believe that the ever-expanding SARS-CoV-2 testing is a critical element in our response for COVID-19, the report goes on. And he said, for tests to be maximally effective, coordinated actions across the systems and the jurisdictions are necessary. Ideally, this requires federal guidance, leadership, and support with strong jurisdictional buy-in at the state and local levels. Now, the report calls on the U.S. Department of Health and Human Services, to appoint a panel to oversee and organize the testing. The panel should include representatives from the public health, clinical laboratory, and medicine, as well as laboratory testing, research and development, and marketing people, and product support industries, such as ethicists, legal scholars, and elected officials. Now, Dr. Ulsterholm also noted that some states are combining data from antibody tests to make estimates about how many people have actually been infected. Now, the Food and Drug Administration advises against using these tests in this way, and so does Dr. Ulsterholm. You need to do the right test at the right time to get the right results. Nobody's thinking through that. Plus, there's not enough coordination to ensure that the states have the testing supplies they need. To this day, they still don't have the testing supplies they need. This is a system-by-system situation, and if any part of the system breaks down, it breaks down everywhere. And what good are the test results if you can't trust them? So this has been a problem for a while. And there are numerous news reports today that people are combining numbers. Some states are reporting them properly, and then the CDC lumps them together. Sometimes the states are purposely using the wrong numbers. So again, what do you do right now? Here we are, we're close to almost the end of the week number 3 in May. We're a good 11 weeks into this by now, by the president's count. And even though this started back in January, so we're 5 months into it actually. Every week, unemployment numbers keep climbing. A bit slower than in previous weeks, and that's probably a good thing. But the totals are actually staggering. The stock market is still bouncing somewhere between 23,000 and 25,000. There's no real direction with that just yet. And even professional people aren't in a rush to go in and start buying things. Now, they keep waiting, and there's a number of people keep waiting that they really believe there's going to be a vaccine before the end of the year. And that's why a lot of these stocks keep going up. But they stay in that range because not one competent physician actually believes that there's going to be any vaccine before the end of 2021. And even at that, it would still be a miracle. Most vaccines take at least 10 years to develop, because you got to develop the vaccine and then you do a number of clinical tests to make sure the damn thing is safe. To squeeze that into a year and a half is an absolutely phenomenal situation. To squeeze in 6 or 8 months is probably not anywhere near realistic. Now, as more and more people start heading back to work, okay, for what the new normal is going to be at this point in time, there's still a fervent group of people having a problem with wrapping their head around wearing a mask. I don't understand this by a lot. Okay. These folks, none of which are frontline healthcare practitioners working directly with COVID patients on a daily basis, are spreading an amazing amount of twisted and distorted information over the internet. They're hollering about their personal rights, to masks don't work, all the way up to masks will actually kill you. The stories are amazing. Yeah, I was a registered respiratory therapist for over 15 years. I worked in rural hospitals. I worked in community hospitals. I worked in Inner City University Medical Center. I worked in an ICU and a CCU, a pediatric ICU. I worked in a level 1 neonatal ICU and a level 1 trauma unit. Okay. Masks work. If they didn't work, doctors would not be wearing them for years and years and years and years. Okay. You can't go into an OR, an operating room, without a mask. That must be because they don't work. No, they work. Okay. They work. They do what they were intended to do. Okay. There's a specific reason for each mask. Now, a properly fitting N95 mask will prevent you from getting the virus most of the time. Now, for me, if I was in a hospital right now, they would not let me work anybody with respiratory isolation, because with a beard, you can't get an N95 mask to seal properly. Okay. So, however, okay, if you do have one, it'll prevent you from getting infected from someone else. Now, all the other masks, all the other non-N95 masks, the surgical masks you see, the bandanas that you see people with, okay, the reason for those is they prevent you from spreading whatever disease you might have to someone else. It's that simple. Yeah. It's just really quite that simple. Now, you can run off all day long about your rights, and it's an amazing thing. But understand, okay, you put clothes on before you go outside. It's pretty simple. It's just part of being socially appropriate. It's socially appropriate to wear a mask when you're within 6 feet of somebody else. Now, if you're outside and you don't see somebody for 30 feet away, you don't have to worry about wearing a mask. But as they get closer, you better put the mask on. It's just being polite. That's all it is being polite and respecting someone else's space. You don't go around just coughing on people. Put a mask on. Okay, it's a polite thing to do. Nobody's trampling on your rights. Okay. You're not going to go to hell if you wear a mask. You're not going to die if you wear a mask. Okay. There are a number of off-the-wall posts. Well, this person has asthma and they wore a mask and they died. No, they didn't die. I'm a respiratory therapist. I understand these things. I've treated people with asthma. I've seen people die from asthma. I've intubated people. Okay, I've actually put a tube down somebody's throat a number of times, from infants to adults. Okay, they don't die from wearing masks. They die from other things. It wasn't from wearing a mask. Somebody's got some off-the-wall post. They show a car wreck. Well, this person was wearing a mask and they were unoxygenated and they crashed their car because of that. No, they didn't. Something else was going on. Okay, just because you don't have the whole story doesn't mean that something else isn't going on. Now, just understand, all these people, they all think the world's still flat. If you keep going in that direction, you're going to fall off the edge. Well, the rest of the world understands you can keep going that direction and you're not going to fall off. The world's round. Wearing masks helps people. Now, whether you're wearing a surgical mask, N95 mask and bandana just around your face, at an absolute minimum, you're going to be protecting other people from what you might have, which is the minimum that you can actually do, which everyone should be doing at this point in time. Now, if you happen to have an N95 mask, good for you. Chances are when you're wearing that mask, you're going to stop most of the problem from getting to you if you're wearing it properly. So, my little rant for the day. Again, I'm Dr. Fred Rouse, the Real Money Doctor. My only goal is to help you get, protect, and enjoy your money, your life, and your retirement. I'll post this video later on today, probably tomorrow, on my YouTube channel, The Real Money Doctor. Like and share it there. Okay, there's some other videos I keep posting there every now and then too that might be of some interest to you. But again, I appreciate spending time with you. I look forward to spending some time again tomorrow, Friday, and that'll be our last thing for the week. Okay, and Friday again, I try to take the weekends off, try and catch my breath somewhere in between. But again, I'm Dr. Fred Rouse, the Real Money Doctor. I appreciate you being with me here today, and I look forward to seeing you again tomorrow around 7 o'clock. Thank you.